Okay, so now we're going to try to open up the abdominal region. So you need to make sure to remember that you are going to use your scissors, and we're going to go in front of the umbilical area. And you may have to flatten out your pig depending on how squashed it has been. You're going to kind of make a pinch right in front of the umbilical region. You're going to take your scissors and make a snip hole. Okay, so what I've done is gone through the muscle, but I didn't go down into the organs. We do not want to push down with our scissors. We want to be cutting with our scissor point up. So from there, you're going to go into that snip hole, and if you notice, your ribs kind of make this V coming up towards the sternum. We're not going into the sternum yet. So you're going to go into the snip hole, stay right just under the muscles, and cut a line. You don't want to cut your liver, so keep your scissors up. Keep pulling up on that, up into the V. From the V on both sides, you're then just going to cut through that muscle again and follow the rib line down one side. Go back to the V, and you're going to follow the edge of the ribs again. You don't want to cut the organs, and it's okay if you cut the rib a little bit. Once you've done that, you're going to see there is a vein, okay, that is attaching to between the liver and your umbilical area. So I would like you to cut that closer to the umbilical area so that releases, and then you have a little flap hanging out there at your liver. Right, now back at where you made your initial snip hole, you are going to make a flap towards your hind leg. So we're going to just go back to where you were, and you're going to cut towards the angle of the leg to let that flap. Go back to the other side, and again you're just at that where you made your first cut, and you're going to make a cut back here to the angle of the leg. And what that does is it allows us to see the bladder that's inside. So now we have these side flaps. We can now see the organs inside your pig. So in order to kind of continue looking at your pig, this one is kind of difficult. You want to pull the diaphragm down off of the body cavity. So you have the liver, you have this big brown chunk that's going to be right at the top. There's the diaphragm, which is our muscle that separates the chest from that. So you're going to take your finger and you're going to feel that membrane or that muscle, and you're going to kind of dig a little hole, and then you're going to peel. And it's going to make nice little noises. Peel that muscle down one side. Put your finger back in there. And peel the diaphragm down the other side. And this allows you to have the diaphragm laying out of your way. Now what you can do is take your scissors and cut through some of those ribs. And give yourself a little more room to work. Just cut off some of those ribs. And again, if your pig is leaking, you might want to have paper towel, which I did not do. And get rid of some more ribs. So now you can kind of see inside a little bit better as far as where the organs are. All right, so we have the liver, and then underneath the liver, we have a little sac that's depressed in there, and that's the gallbladder. And coming off that sac is the common bile duct that's coming down from that region. So that's that white line that's coming out from the gallbladder. Under our liver, we have our stomach, which could be full of air and it could be fairly empty. And there's a spleen that lies along the edge of the stomach. And then underneath the stomach. And mine's not really all that clear, but there should be like a lobular structure. You may have to break a little bit of the membranes. And this is the pancreas, and it looks like almost like cottage cheese. Hope I didn't ruin that. You can't really get under it very well, but you can see the little edge of it right there, the little tail of the pancreas, and it comes up under and nestles against the back of the stomach. We'll open the stomach here in a little bit. The stomach opens into the duodenum, the first part of the small intestine. So this tube coming out of the knot at the end of the stomach is the duodenum. The small intestine then turns into jejunum. So the majority of your small intestine is jejunum, so most of this part. The jejunum continues on through most of that. So it's just kind of turns into a new name at the end, which is called the ileum. So you kind of got to roll the intestines around until you kind of see this spirally chunk. And that's the spiral colon. Now, the ileum, you know you're at the ileum when the tan part of the small intestine turns into this green sac. All right, now this green sac right here underneath the spiral colon is the cecum. This is the first part of the large intestine, or the colon. So this is our cecum, and you have the ileum, which connects to it with a valve called the ileocecal valve. And normally we would cut through the top of the cecum and find the ileocecal valve inside of it and have to clean out the poo that's in there, which you can do if you wish to. I might come back to that here in a little bit. So we have the cecum, we have the spiral colon, and then the rest of the colons are basically, I kind of use them backwards to help you identify them. Now I have a girl pig, and so her ovaries and oviducts are kind of stuck down in here in her pelvis. So I'm kind of moving those out of the way, but where this green tube drops into the pelvis, that is the rectum. So I'm kind of walking backwards here, and in front of that, right in the middle, is called sigmoid colon. The sigmoid colon was connected to the descending colon. I can get some of the mesentery off so you can see it. So up here beside your kidney lump is the descending colon. So we were in the rectum where it's hidden, sigmoid colon, descending colon. That green tube's going to cross the body, so if you stay in the green tube, where it comes across the body, that's the transverse colon. And then you kind of got to roll everybody out of your way, all the intestines again. And your transverse came across the body, and I'm still on my transverse, so then I have the ascending colon that's coming up the side. All right, so it's technically the ascending. It cuts across its transverse, descending by the kidney, sigmoid in the middle, and rectum down in the hole. And then, of course, you have the opening at the back, which is the anus, and the puckering of muscles is the anal sphincter. If you have a girl pig, do not confuse it with the urogenital opening below that. So the anus is actually there at the top. So we will make another video to show you opening a couple of the structures that you still need to find, so that at least gets you a majority of the features that are in there.